Today we're going to talk about some of the hidden factors that are causing or impacting jaw pain. What most people don't know is there's some things that happen on a regular basis that lead up to jaw pain, but you just don't realize it. 9 times out of 10, people with jaw pain have already begun to experience neck pain for a chronic period of time. So when I say chronic, it didn't just start yesterday. This pain usually has been going on for many months, many years. It's been going on for this long period of time, and it hasn't been managed appropriately. So going to the chiropractor, going to physical therapy, going to see all these different providers, if you still have neck pain, that is a precursor for jaw pain. The other precursor for jaw pain is headaches. So a lot of times people will have daily headaches, weekly headaches. Sometimes the headaches will only come on bi-weekly, or maybe they'll get 1 or 2 a month. So the frequency of the headaches doesn't matter, but the fact that you get headaches does matter. Those headaches can be behind the eye, they can be the side of the head, the top of the head, and then also the back of the head. So the keys to treating jaw pain are usually addressing some of the issues with the neck and the jaw itself. Think of it as like a trickle-down factor. You start to have symptoms here, maybe down into the shoulder blade, then it starts to give you symptoms up here and into your head, and then eventually it spreads and moves to the jaw. And that's why jaw pain is typically called temporomandibular joint disorder, TMJD. If it was just temporomandibular joint pain, then that would mean that it was just occurring at the jaw. The reason we call it a disorder is because it impacts several different areas of the body. So it impacts the lower neck, usually the upper neck, and then also the jaw. These 3 things come together and they give you lots of pain, lots of discomfort, and oftentimes patients don't know where to go or what to do. But those are the hidden reasons that most people experience jaw pain. What you can do proactively is you can go get your neck pain treated or your headaches treated before you experience jaw pain. That way you don't have to deal with all 3 when it comes to treatment, because it does make it a little bit more tricky. If you like this video and you found this helpful, please hit the subscribe button below. We'd love to have you join our community and learn a little bit more about who we are, what we do, and how we can help you with your neck pain, jaw pain, and headaches. Thanks.